this week is National Health Center Week. And this is a time when every August, we celebrate the 1,400 community health centers that serve 31 million people across the country. And together, we're making a huge difference in the health of the nation. We are the largest provider of primary care in the nation. And today, actually, the executive director of NAC, the CEO, has launched a new initiative and that he's announcing today. And so I get the pleasure to tell you a little bit about it. And that's, currently, community health centers serve 1 out of every 10 Americans. And our goal over the next 10 years will be to serve 1 out of every 3 Americans, which will require significant infrastructure funds to be able to build the health center network that we need to be able to meet the needs of the 100 million people that still need access to health care across the country. And that strategy, the National Association strategy, is to leverage science, education, policy, and work with our national partners, our state partners, our local partners to address the needs of primary care, the social drivers of care, and also be able to increase access to care so that the health status of communities all over the country are improved.
This is Dennis Walto. I am the Chief External Affairs Officer at Chiricahua Community Health Centers. Pleasure to see you all here. Just to give you a quick idea of the run of show today, we'll have some remarks inside here. Then we will don our protective gear and walk across the road to our new clinic. We'll take turns kind of going in and out of the building, but you will be walking across the road and then through some dirt. So
first of all, thank you everybody for showing up today. We had people actually that came significant distance for this event. Really, it's worthy of celebration. That's why we keep celebrating every step of the way. Definitely, this is not a project that Chiricahua has. It's not a project that we've done alone. This really encapsulates a community-based partnership project that is not only Chiricahua and the community of Willcox, but really spans all of Cochise County, and you'll hear more about that. And as Dennis likes to say, in order to achieve optimal health, it takes a county, right? Not an organization, not a city government, it's gonna take us all working together to overcome some of the health disparities that unfortunately we face here in Cochise County. And that's what this is all about today. Once this is all done, including the parking lot and everything, then the state, and we need to outfit it, and then the state comes and looks at our exam tables, every last little detail. They come and they certify that it's ready to be opened. Because as a facility, we are inspected as a facility by the state of Arizona. Once they give that, we can credential all of our providers so that they can work here. And that is usually somewhere around 3 months. So everything just takes time, and we'll be pushing on those things on our end as well, because our current provider staff and patients are also ready for this facility. In some cases, it's difficult for the patients even to get on the mobile, given a disability or just discomfort getting up on the mobile or how it feels in the mobile. So we are very anxious to get this open. I know we've been talking about this for a very long time, but here it is. We're getting as close as we could be. And every time I come up, there's significant change. You guys can see it more than I can coming from Douglas, but yeah, this is going to happen. It's the real deal. And then, in case you didn't hear, Jesse was explaining we're planning on, in the future, we're looking at potentially opening a pharmacy because we're well aware that Willcox lost the pharmacy. So we took a step back there. So Deli Web, we don't have a representative, but they paid for the majority of this modular clinic that we have here today. It's a Deli Web Foundation, and very generous, and not something that we could have done without them. Also, a really key component to this partnership, and again, you'll hear more about this, but the Sierra Vista Industrial Development Authority really stepped forward because the difference between what the modular cost, the money that Chiricahua had, and the actual cost, there's a gap in there of additional cash, and that's where the Sierra Vista Industrial Development Authority stepped in, and they helped us with a $250,000 low-interest loan. So again, going back to, it takes a county. I think this is just an exceptional example.
And let's not call it filling in the gaps, but let's say that anytime you can make healthcare in your city better, people are going to come here, you know, and that's what we want. We don't, you know, we don't want to be Phoenix, but we need to be a little bit bigger, and we need to constantly grow to keep the amenities that we have.
And really, we just want to say thank you to the city of Willcox. You know, oftentimes you hear Sierra Vista and we seem isolated. We seem to be in our own silos throughout Cochise County. And one thing at the Sierra Vista IDA that we wanted to focus on is making sure that we are becoming a regional partner and helping all of our communities grow and expand. We are committed to not only Sierra Vista but Cochise County so that we can become not just bigger but better communities, and we can retain our youth and give them hope so that they can stay here and grow our communities. So I just want to thank everyone who has helped us fulfill our mission, and we are super excited about the growth of the city of Willcox and this project, and we look forward to being a partner in the future for more things. So thank you all so much.